Today topic about shoulder problem. One of our viewers had plead for help and talking about shoulder and neck problem at the same time, and they send their MRI. So I decided to make today topic about shoulder and neck problem. Now, one thing about shoulder is being stabilized mostly by our muscles. We have a lot of joint in our body that 80 to 90% are stabilized by our ligaments and tendons. Not in case of the shoulder. Shoulder, because of all the degree of freedom he has, mostly is held together by muscle. Why that is important? It's important because its stability comes from muscle. As you can see, muscle are all being controlled by our nervous system and brain, and they all go through our neck. When it goes through the neck and it stabilizes all this muscle around the shoulder, are being innervated through all this nerve that come in between this vertebra. So why am I saying that? Because if this vertebra are being compromised, the pain or whatever interference is being affects your shoulder stability. Sometimes you will have the problem for months, a year, before even you feel any pain or any symptom. And the reason is sometimes your front muscle, they don't work as well, and some other time the back muscle, they don't work as well. So the stability, that goes back or forward. Have you ever seen people that in the gym they only work the front muscle and the chest muscle, they want to look cool, and they look like this and they walk like as if they are very, but they're not. They really have a shoulder problem. So this is what chiropractic usually can do by manipulating and relieving all this joint from pressure. It can help both shoulder and neck. Now, let me explain something. When I'm saying the vertebra could have some interference, there's several ways. One, it could be misaligned. The vertebra can misalign side to side, laterally, or posteriorly. When you see in your MRI says intervertebral encroachment, that means right here where the nerves coming out, either there are bone deformity, soft tissue deformity, or misalignment that causing this nerve to be pressured on. So you really cannot be sure if which one is until you really open the person up, but most likely is misalignment. Now if you have a spondylosis means this joint, this bone around this area is kind of being deformed and the whole bone is moved back. So when you find spondylosis of a vertebra, chances are you will see some deformity in the bone. So what will happen, all this deformity in the intervertebral foramen and the bone deformity, they can cause pressure at this level of nerve. And then the nerve could affect both neck most and people that they have more than one joint problem. In other words, shoulder, neck, and upper body, other advanced stages, or they have an inflamed body to begin with. So one of the things you can do to slow down the inflammation, the pain, reduce your inflammation. And I know people don't put two and two together, musculoskeletal issue with food, but the very first thing you can do to eat foods that, stop eating food that they create your inflammation or detox your body. Now, for those of you are interested in the detox and reducing your inflammation through food, please email me at askdrmasood@yahoo.com and I will email the detox to you. So, if you have any question from this, please email me and I will answer you. Thank you.